it's all fun things so that we have programs in place. And especially housing. That was a big problem. And so then, on the next page is other bills of interest. It's not Kupuna, but it affects Kupuna, the homeless, condo insurance and people who live in condos. The fireworks, I get lots of complaints from Kupuna and also in traffic safety and this, what should we consider next session? Not all my priorities, but priorities from the Kupuna caucus. So these are all bills that didn't pass, but we should consider. And your hearing aids are there, but Rick brought me a person who's working on hearing disabled and trying to get more people understanding that, you know, if you get assessed early enough, you can diminish the kind of impact on the person. So she's looking at, like we passed last time, which was the screening for cognitive ability.
For Alzheimer's.
For when you do your Medicare screening, your wellness screening once a year. She has this idea that you could have a hearing test at your wellness screening every year so that you can pick it up, because most people don't want to go and get just an audiology test, but if you have that. And then the last is what I just mentioned, streamlining the current supportive care housing in the community and making it more affordable. And then two that I want to bring up, because you folks, if you testify or don't testify, but there are two that I call the real uglies of your, I think I brought it up with you. Full council, is legalizing adult use marijuana and legalizing gambling. Two things that I think would be a disservice, costing our community a lot more money than it will bring in. But some of my colleagues feel that, you know, we need to generate revenue, but to me, that's not a good way to generate revenue, because the costs are really high on both of them, for addiction and for really the cost of administering it well. And we don't do that most of the time.
One question, number 7 in the front,
Yes.
fall detection, are there any timeline or whatever?
Yeah, I think, you know, I think the Department of Health,
Yeah.
and I don't know his name. Do you know his name? He has been coming for like 3 years. He has a program already, so I'm
really?
sure it can.
Stan
So-
Michaels.
Yeah.
Stan Michaels. He retired, but.
Yeah,
okay.
but he
Yeah.
comes and he testifies. So it finally got them $100,000 to do this program. So you could find out for them, I like
Yeah.
them too,
Yeah.
who's in charge of that, but
That's
yes,
good.
and it's a good program.
Okay.
No, I have vertigo, but I've,
Oh, see, that's good.
this
for you.
is, I fell down.
Oh, yeah, tell you
Yeah.
how to
So
fall.
this is sort of connected to it, you know, I'm a senior, so. Oh,
Yeah,
okay.
no, this is just for you.
They are very interested in it, yeah, so they have a
Yes.
program.
Yes,
Good,
yes.
good, okay. Thank you.
yes,
I wanted to point out, you said that on the second page, where you said on homelessness. You
Yeah.
said that seniors aren't concerned, but as it turns out, 40% of the homeless people on the Big Island, on both the West Foy and on the Hilo side, are seniors.
yeah.
And that 60% of those are women who are seniors, and they're on the street, and they are not sure how to work the system to get the help that they need, and they're
Oh,
not
wow.
asking for it. A lot of them don't know they need to ask for it.
Yeah, so if you can give me your email address and contact and information, who's in charge of homeless on the Big Island. But if you can give me the
Who's in charge
information,
of
I can, you know who?
Housing services. You can do that. I could probably.
Give me your
Yes.
name and then I can connect you, but there is an Office of Homelessness and
Yes.
Housing Solutions.
Yes.
And they have money to do Ohana zones, Kauhale, on all the neighbor islands as well as Oahu. So we need to connect up, because if in fact 60% of the population that are homeless are seniors and
Yes.
women, then we really need to be looking at
Yes,
that.
we need to be looking
Yeah,
at
yeah,
that.
thank you.
Yes.
Yeah,
I know that, Charlene.
Eboshi.
Eboshi is very involved. And, trying to find the services for the ones at risk, because
Yeah.
there are many that are still at home, but are
Yeah.
struggling. They're just back from the hospital or wherever they are, and they're basically trapped.
Mm,
And eventually they become, on the street,
yeah.
and
Well,
there's,
and that, so we've been trying to, so I've been working in the homeless and housing arena too. And one of the things we're looking at, and in fact, I just came back from Maui yesterday, where the Ways and Means Committees does site visits on various islands to look at what we funded, to see if anybody did anything with the money we gave them. But one of the things is affordable housing. So we are pushing the Office of Homeless and Housing Solutions, the Hawaii Public Housing Authority, and what we call the Hawaii Housing and Development Corporation, HHFDC, to get together and develop a continuum
yes.
of housing. So my little continuum is for Puna, but the continuum is this big picture, is like, okay, you start with getting them off the street, so you have shelters, temporary shelters,
Right.
ohana zones. Moving that into the next, so that you give services to them, so they move into a kauhale, which is a little bit more permanent, it's this little houses that you see. And you give services there, but the services there supposed to move them to another level. The next level would be 30% to 60%. This is the HPH, Hawaii Public Housing Authority. And you move them there, but you don't want them to stay there. You want to, some of them stay for 20 years, but we want to move them to the next level, like try to find them permanent, independent housing. So that's kind of the continuum we're looking at for housing. So your women should be the target of, like, at least getting
Ever
them
again.
into
I think so.
a, shelter, to then move them to a kauhale. So we need to know about that, so that we can pinpoint, because what we also ask the agencies is, just don't put them up where somebody says, oh yeah, we have space. You have to put it up where there's a demand. So if that area is like 60% are Puna, we need to look at kupuna type
Mhm,
housing
mhm.
and put them in there.
So I won't take up the
Yeah,
rest of
yeah.
your time,
You can
but,
talk to me.
I think what we're discovering is that there's a lot of gaps.
Oh, yeah.
There's information only, I can only give you information only, or you need to do this and that. It would be good to know what is available, I mean, through all statewide, countywide, and what identify those gaps and try to figure out how to bridge
can
those
ask the
gaps. So
agencies
maybe
to do
that's
that, yes.
something that needs to be championed,
Yeah.
is some kind of a
Yeah,
study.
you can,
Yeah, so
Thank-
Sarah, we can contact her
Yes,
and have more discussion.
yes.
Yeah.
Outside of here.
okay, sorry taking it off.
No, no,
Okay.
no, but are there other important bill, I mean. you could-
Yes, thank you.
Everything's
Thank you.
here,
Yeah,
and then
yeah,
Derek,
everything's here, and I guess.
Corey probably has some, but Derek has a question.
Senator, sorry if you covered this already, any word on legislature calling a special session? Haven't heard much on it.
We're not sure, because we have to see what is the administration doing, right? Because October 1st is their new year.
Mhm.
We heard that it's not gonna really impact until not next year, but the year after. Right? I mean,
You're talking
so,
about Congress.
yeah, Congress. So, and so, we're not sure, so we are at the ready. There are dates that we have set aside, but we're not sure.
If a special session is called, though, likely it'll be driven by budget policy determinations in Congress, and to see what gap in
Yeah,
strategies we might have.
The other thing we're talking about is, okay, so there are all these edicts, I call them, from the Trump administration. But how do we how do we protect ourselves? So some of that's like the 50 million that is
Mhm.
in controversy to me. It's like, okay, I don't see a controversy. If there's a need and if your funding's cut, that's where the money should go. So, but there is 50 million set aside for that kind of all the nonprofits that get cut, because those are the people who do all the work for us.
I hear you.
And then, in terms of what we do is looking at, well, all of the Medicaid. That's where we have to shore it up.
Now,
But there might be other
Mhm.
how do we do it on our own dime?
got it. I
So
think the
set
one
this
feedback I would have is that as best we can here at home to identify the potential impacted populations. I think that will really drive what strategies and resources
Mm,
we can even fractionally put a dent in. Yeah, but it's hard to, we're still doing policy interpretation even in DC based upon the bill. So by that time, the policy clarification makes its way down from feds to state to community level, it's tough. But I think as best we can, if we can identify potential impacted population, we can at least start putting potential strategies on the table.
Yeah, that's a good point, yeah.
There was a Hawaii Public Radio segment I sent out to some people talking about the immigration issue and a special
That's
session
getting
on
done,
that,
yeah.
but that hasn't happened yet, right?
It, bits and pieces, right?
Yeah.
People get pulled in by Department of Homeland Security, but it's not, we don't know if that's a full-on policy and, yeah. It's,
Okay,
Makes sense.
yeah,
but nothing about a special session just yet. It's just waiting to see.
yeah,
what
we just
happens.
have dates. I mean, we're at the ready, but
Yeah, I'll share in our meeting a little bit, because I just came back from the national conference for
Mhm.
Meals on Wheels.
mm,
And ATI, wonderful lady Claire came and presented from DC
mm.
about stuff, and they don't even know in DC what they're doing, just
I
yet.
mean, but, you've got this crazy guy going up and down, it changes every day, so how,
Well-
there's no policy, there's
Yeah.
no policy.
Well, to that note, Senator, the lady that was presenting didn't want to share her slides because it already had changed 3 times since she wrote it the day before. So, go ahead.
Yeah, no, I just wanted to ditto Derek's request, I think. In order for us to make good decisions on policy moving forward, I think we really do need to hone in and figure out what is that potential
Mm.
Medicaid population that could be affected, right? And what do those numbers look like?
Yeah.
So then we can protect
And I think,
Who they are.
and who they are, yeah.
yeah, Judy folks are working on, MedQuest, because she has the most numbers, I think, in terms of who's impacted. And looking at, I think part of it also is looking at who are the most vulnerable, right? They're getting Medicaid, but whereas the real, I mean, we can't state everybody, but how do we distribute it so that, nobody's on the street again?
Right,
I think we talked about this though, but it's important to bring it up. You're looking at 2 levels of impacted groups, right? One that are no longer eligible, whether it be a combination of the work requirements, whether it be the political asylum, refugee folks no longer being eligible. That's more the black and white as far as who's eligible and who's not. The other group that I think we should equally be concerned about is actually those folks that are eligible. But because of all the bureaucracies on certifications, recertification,
Recertification.
documentation, so that you're caring for a dependent family member will never make it to the starting line.
Right.
And that might be likely the bigger impacted group
Yes.
than the
Right.
non-eligible.
yes,
Mhm.
Right.
absolutely.
Well, then
Absolutely.
SNAP, they raised the age from 55 to 64. So that wipes out like a 10-year period of folks that were covered, that we know.
Right.
Yeah.
I'm,
So,
yeah, I'm wondering if there's something about emergencies, like during emergencies, can some of the requirements be waived? Is that something that we can, as a state, write into our portion of the SNAP
Yeah,
program?
that I don't know. I mean, that's, something that with research. I know, are you talking about during emergencies on Medicaid that can be waived, or are you
Yes.
talking, yeah,
Well,
on?
for example,
different-
getting hot meals or frozen, I understand you can't get frozen prepared meals anymore either.
That's
Besides
not-
hot meals.
That's not true.
I don't- yeah.
I'm
You sure?
So Hawaii Meals on Wheels, yeah, we deliver
Okay.
5 or 7 frozen meals every
Well,
night.
I
but
mean, I think he's talking about if you go to the KTA and you buy
Oh,
a frozen.
They don't have them?
No,
Yeah.
With your,
no, so in an
Oh.
emergency situation, to be able to do that.
And you won't be able to-
It's like-
Yeah, it is. To qualify. This is it, they're gonna qualify. Okay, so we're going a little bit over, so,
Okay. Sorry.
Okay,
Any-
so,
How can, the question I have is, how can we be that voice? For, you know, the
folks are
groups that we
strong voices.
represent.
Yeah, you're strong voices. I
we're
think.
going to talk, so in our meeting, we're going to figure out who's going to take which bills and follow them and be that voice lead.
But I think
for
that
us
just to
today.
add on to that, if you can research it more
Yeah.
and see the needs, like
Yeah.
60% is a big number, is
Yeah.
the same all across the state, in other counties. But it's a strong voice for us
Yeah.
when we hear testimony that is not just rubber stamp, get 100 of these saying the same thing, but it's really telling stories and saying this is the impact. And especially if you say Hawaii County or Kauai, at Maui, that it makes a big difference because now we see that this is something we really need to take, in consideration because it's affecting a lot of people. And those stories are really helpful. It's not just, cookie cutter, we're just sending out the same thing. Because if I see all these testimonies that come in and they do, it's just emails, because it's easy to just go. And I get 100, they just kind of gum up my. That's right, it's the same thing. It's okay, got it, 100 there. But if somebody comes in and says, I really am struggling, this is the problem, and I have other people who are also struggling. And that's testimony that comes in, that is significant. We really do try to help the vulnerable. So that is very, very significant. So even PABEA comes in and you do your share, it's telling your network. You need to also get involved because the more people we hear from, it's a big problem. Because basically legislators are for the majority.
Okay.
Right,
Yeah.
right.
So what I really appreciate is how available you have been, and Rep. John and many of the legislators, to just that question that you asked, Sarah, to giving us feedback and guiding us as to who we should talk to as we go on. So I'm just, Rep. John's gonna have to take off in a few seconds, but do we have any questions?
Yeah.
Well, just one more quick question. I just want to understand that the second page is
Why
of
don't you ask Rich first and then we'll come back.
Yeah,
okay.
he's gotta take off.
The items on the second page are those,
Oh, no.
We're gonna ask him to
Ask,
come on.
sorry, ask, you have, no.
So just his volume. So Rep. John, if you wanna just chime in, any input that you'd like to give us in wrapping up? And then we'll move to Shelley's question.
Yeah, let me finish because he has a question.
Okay. No, I think I was just talking about SNAP and I've heard that it's come up too. So that's something that we're looking at because food insecurity is, other than housing, that's probably the second biggest need. And we're seeing a lot of impacts with our food banks. So anything we can do to also shore up issues with food insecurity, especially among Kupuna, that's something that's gonna be a focus too next session.
Okay. All right, appreciate it. So our website on Meals on Wheels, the opening paragraph says, on any given day in Hawaii, 70,000 people are food insecure. That's right now without even the changes that are coming. Huge issue. Go ahead.
no, I just wanted to make sure this second page, it are all the items that, the Kupuna Caucus legislators are prioritizing?
No,
Oh,
sorry.
okay,
Let
okay.
me explain
Okay.
what I did on this.
Okay.
So this,
Oh,
what
excuse
should be considered are just bills that were in, so like the tax credit for relatives, that was a high priority, that was on our list,
Mhm.
last year,
Mhm.
and it didn't pass.
Okay.
So it's for consideration. All of these are for consideration.
Okay.
Not necessarily that we or I are saying this is a high priority. The other one is the SNAP one, so that's, if Rep. Chun is saying that, with ag and you doing some things, that might be another one that
Yeah.
you might want to consider because food insecurity is a big thing for our people, And then I just mentioned the $50 million bill is to help agencies, and that passed, but that can support areas of need. The medical leave has always come up every year and everybody says it's too expensive, but that's also another issue. That has had a hard time passing. The hearing aids, that's near and dear to Rick, has come up, what, 5 times?
Oh, no, more than that.
Oh, more than that, okay. We've been working on that. And that's why I added in, Tori's program.
Mhm.
That one other way of skinning the cat is to have a hearing test, in your annual wellness visits for Medicare, beneficiaries. So it could be picked up early enough and maybe that then becomes a medical requirement. That's
So I'll talk
needed.
about Tori in our meeting, but we met with both Rep. Chun and Senator Morawaki, and some of the thought is if we get the assessments to go, that then we'll finally get some data to support moving forward, because we don't have data right now.
That sixth one is mine. I
Yeah.
mean, that's not mine, but I'm trying to support, as I said, this continuum of residential care,
Mhm.
living arrangements. And the Office of Healthcare Assurance is now led by Debbie Morikawa.
Mhm.
And she is really looking at different models of care. I mean, I try to understand the arches and the foster care, and if you look at the law, because I always start with the law, you look at the law, it's all over the place in various
Yes.
chapters in the law. And so one of the things that we had talked about is just pulling them all together and calling it community-based care living. And then it's all in one place. And the idea is that we have a continuum of living arrangements. And that to me is a really big thing. It's more systemic, but I think it will help get it more cost-effective care and living arrangements. And then you could have more affordable living arrangements than what we have now, which is like $5,000, $10,000, $15,000 a month.
I think that should live in the long-term care master plan.
Yeah, I
Right.
think so. Yeah.
Yeah.
I
to
think
consolidate,
Yeah.
yeah.
Yeah, is Caroline still, she's working on that, right? Because there is, we did pass a long-term care master plan. And it's in the EOA working with Jack Lewin, SHPTA.
Yeah.
And so that's what PABEA should be asking Caroline and pressing her on working on. Yeah, because I think we put money in for a staff position. Yes. But that, yeah, that, it's gotta be more strategic and more specific as to what we need to do. And living arrangements and food, those are two
Mhm.
big things.
And speaking of gaps, I mean, the preventive piece, right?
Yeah.
The ones that are at risk of homelessness.
Yes,
There
yeah.
seems to, well, I mean, there
Yes.
seems to be a huge lack of resources being put towards.
Well, all the language in the law does say this is for homeless or people at risk of
At
being homeless.
risk.
So it's supposed to cover. Now that, yeah, so, they always go after the legislators. I have.
No, I know, no.
But no, but I'm just saying that, but where the problem is in administering the law. So administering the law, and we give them plenty of money, millions. And we come back, and that's why WAM goes and visits, and we look at that, and we say, well, what are you doing? Where's the services, and where are the gaps? Give us some
Right.
data. And just yesterday, we went after the agencies, saying we need data-driven services.
Yes.
And they don't have data. They
Right.
said, oh, the partners in care get the homeless data, and they don't share it with us because HUD says, it's proprietary. Well, hell's bells, we pay money too for
Right.
the agents.
Right.
So we're trying to get the Office of Homelessness to get that data. Because and last year, they didn't even do the survey at a point in time for unsheltered. I said, wait a minute,
Right.
we want the unsheltered to shelter them.
Right.
You don't need the sheltered people. So those are the kinds of,
Right. Right.
conversation we have had. So when you bring that up, yes, this is my frustration. That they're not doing what they're supposed to be doing.
Right.
And we give them money, millions, $50 million.
I keep hearing that there aren't enough social workers, there aren't enough people in public health and that kind of thing. right?
That is true too.
You
The
know,
big missing piece from what we see is more of an investment in mental health services.
That
So
too.
because it's so limited as far as the resource and professionals, it keeps those folks in the streets, on the streets, and it takes individuals who are housed into the streets, because a lot of like hoarding, for example, is not, you have some that physically can't do it, and that's where we can help, right?
Mhm.
But you have many because of mental health issues.
Mhm.
It's not a physical inability to do it. It's a mental health issue,
Right.
which is why they call it.
Right,
Then they can't have their home, and they can't pass their home inspections, right?
they can't pay their taxes.
Yeah, so then they end up on the
On the
streets. Yeah.
Right,
Corey's gone.
there's a lot of that,
So I'm gonna wrap this part up so we can move into our actual meeting.
yes.
Um,
Thank you.
But this has been very, very helpful, Senator.
Senator Moriarty.
And Rep. Chun took off already.
Yes.
So thanks, everyone.
Okay, thank you.
Thank you.
Yeah. I just.
You're welcome to join us anytime.
Okay.
In your spare time.
Yeah,
Sounds like
it's,
very helpful, very interesting. Thank you.
Yes.
yeah.
I'm glad it helps. And at least you can see what we did, the legislators did last
So
session.
most of us know, but the Kapuna Caucus, so it's a legislative Kapuna Caucus, there's also a Democratic Kapuna Caucus. Legislative Kapuna
No.
Caucus is always,
Oh,
yeah, the Democrat one. they
Or
don't
is it?
So it's easy to confuse the two.
Oh,
Yeah, but yours is usually follows our
we
PABEA
are,
on the first Fridays
we
of the
are.
month. We're on
open
just
to
on a different day today
anybody.
because
So
of a
if you
conference.
Aren't in the Kupuna
Yeah.
Caucus, you could very well join us. Just give me your email address. And we will put you on the distribution list, and everything is on Zoom. So
Yeah.
you could hear what we do, and you can even give us bills, and we will consider them, and maybe
So
even.
for a new member, we usually, most people just sit in here and watch it. Yeah. Appreciate it.
Okay.
Very helpful.
Thank you for all that.
Thank you very much.
Thanks for coming out. That's you. Oh, Make sure you get that.
This.
You'll be back, huh?
My life.
Are you coming to the conference? And
You
why
know, I
Pacific
have,
Gerontological?
no, you know why? Cause I have conflicts in between, cause it's like 2 days.
Yeah.
Yeah.
Just
So I was-
stop in.
Friday, Saturday.
Stop in.
Oh,
Well, stop in. I'll invite you. I have nothing
Oh,
to do with the conference, but just
okay.
stop in.
Doesn't work that easily. I did that. Unless you pay, you're not allowed.
Whoa.
You know, I had that happen last year.
About you.
Okay.
go in. Just do.
Okay, well, nice
Yeah.
seeing all of you, meeting some of you.
Thank you.
Yeah.
Thank
You know,
you.
you can go out this door and the elevator's right
Okay.
there.
Oh.
Yeah, wanna grab it?
Press the VIP button now.
Yeah.
Thank you.
Otherwise you go up.
Is that
Okay.
the first time that she's ever come to one?
She said she hadn't been here since before COVID.
Oh,
Oh.
Yeah,
Okay,
um,
all right. That was.
I sent all the information except for which elevator. I always just go to the same elevator. I didn't even think of that. So we're gonna back up and we're gonna do roll call now,
Yes.
just for the record.
Yeah, and a couple other people.
Great.
All right,
And screen share is off.
only I can share. Yeah. Poki Balaz, absent. William Kanaka,
Here,
Stephen Lung,
here.
Sarah Maderos,
Here.
Shelley Ogata,
Here.
Susie Schulberg,
Here.
Marilyn Seeley, she's absent. Barbara Service. I think Barbara was on here.
Cheers here.
Gary Simon
here,
and Rick Tabor.
Here.
Our community members, Charlene Iboshi. Absent. Joanne Kealoha,
Here.
Roberta Murray. Absent. John Haoli Tomoso. Absent. Kathy Wyatt,
Here.
Sarah Yuan,
Yeah.
Emily Ishida,
Here.
Koio Nalani,
And that's how you.
Rowena Dagdag Andaya. Absent Derek Ariyoshi. And we had Norma Cup earlier, but she must have left already, and myself, Christina Valenzuela. And you have quorum.
Okay. All right. So that was very helpful. So I guess first on the agenda is to approve minutes. Meeting minutes was. So we get a motion to approve,
So
okay,
Second,
all right,
Any objections?
any objections? Okay, hearing none, and it's approved. Next for discussion, so. What I'd like to do as much as possible is each month have a speaker start with us, but I'd like to, we went quite a bit over. I'm kind of thinking 15 minutes. So instead of getting so much into the weeds, you know, ask basic questions, but save a lot of the rest of it for us here, because we're gonna go through the bills and what's happening with them and what we're supporting and, you know, what's working, what's not, the good, bad, and the ugly, if you will, steal from Kokua Council. So for next speakers, I wrote a few ideas down here. And so first off, I'll mention, so Tori Carapello, so she started a hearing for Hope. I don't know if I mentioned her here before, but a couple Fridays ago, she and I went and met with Senator Moriwaki and Rep Chun and had an incredible meeting. This lady's really sharp. She already had a bill written up. She already had the proposal. They actually added a few things that was really helpful. And her story, just brief, is, if I haven't mentioned her before, first year of COVID, she woke up one day and couldn't hear. So imagine not being able to hear and then try to figure out what to do. And so she ended up, I think her husband actually got her to the emergency room and they ended up doing an implant. So now she has to use a device to hear. She totally lost her hearing. So from her experience of what now I hear, but I've been talking for 7 years about the hearing aid issues out there, and I learned something every single day. She found me through my testimony, and we got together, and I brought her over to introduce her. And I think last year I kind of brought up the idea that I thought, because there's just no data. No data is hard to get anything to happen, and data is a huge piece. So I suggested, several people in the community with hearing issues suggested having hearing checked, having an actual workup when we do our physicals. It's not every year. Some recommend 2, some recommend 3. I've done a lot of just reading about this. So we're gonna try to introduce that. So I thought she might be somebody good to come to talk to us. And what we need to decide is, would that be for just us in the legislative committee, or would that be a good presentation for PABEA as a whole? And we could talk about that. So that's one person. So that would be around the here. So I'm thinking having folks come talk about various bills. So I'll skip to the end. Alzheimer's Association, they won't be ready till like December to come and talk to us. So Kobe, Barbara and I both are, and I think Kathy too, we do stuff with Alzheimer's Association championing stuff. So they've got about 4 bills they're looking at, but that won't be solidified till like December, so we could put that till then. I thought, and I put this out, Gary and Barbara, maybe Kaylee or you guys and Audrey could kind of speak to some of the stuff that AARP is looking at. And so we could consider what they're looking at. I was working with Senator Carl Rhodes on a human rights resolution. That definitely, there's a whole Kapuna section that affects folks. So maybe he'd be willing. There's a couple other folks that are kind of on board with this. When we get that to a point that we kind of narrow it down to what we're doing, they could come and speak. The homelessness piece, so I'm very close to Connie Mitchell, just sat with her and had a whole conversation. She talked about that Kapuna increase, so much so that when I was doing in-home care, she called and asked if our program could come out and help. This was like 6 years ago. As a result, it continued to increase. They've started a separate program around that. But she could maybe come and talk a little bit more about homeless stuff as well. There may be other people that you think of, even from Big Island. I mean, if there's folks, and they don't have to fly in here, they can go on Zoom, right? So mental health is a huge area there that definitely affects our Kapuna. So I've started attending a lot of the mental health meetings, and maybe I could bring somebody from that to speak to Kapuna issues. There's probably something else in here I haven't thought of, but those are things I'm thinking of. You guys probably have a lot of ideas too. And so we're not meeting in October?
We have the public access room, so that's taking the
That's the
place of
presentation.
all of the
Yeah.
committee meetings.
Okay,
So
and that's real key at this point, because we want to make sure everybody, a lot of us have been using it for many years, but hearing just what's available, being able to use that, being able to access that. And then part of today, what I want to do too is us to really kind of focus on what our areas of interest are, us, in PABEA, that we want to follow, so that we can start kind of doing that. The bills won't get introduced till January. This is a really good time. So Sarah, that invite,
Worked on now.
yeah, they're being worked, well, this is the best time to work on these things. And this is the best time to meet with folks over there. Yep, Sarah?
I have a concern,
Yep.
and it came up last year. And that is, if we invite people to speak,
Mhm.
we have to make sure they don't assume that we're going to support whatever it is they're
They know.
telling us about. Well, I'm not sure of that. I think there was a concern last time that we didn't vote for something as a priority, even though these people had come and made the assumption that we were in support of
Okay,
their,
okay, well, we can make sure that they understand that. I would hope that folks know that when they're presenting, that they're presenting their bill and it's gonna pass or it's not going to pass support. It's the same with Kapuna Caucus, they only pick 5,
right.
so.
Right, I think we
we're
should be
presenting things.
sensitive to that, because some
we'll be
people were
sensitive.
a little upset about that.
Who was upset about that? And you
Let's
can do
not
that off the
discuss-
record.
yeah,
can't-
let's
don't
not
have to
discuss
discuss
that.
Okay, I'll stop it there.
So Rick, the next meeting,
So-
legislative committee meeting will be in November.
Right,
And then you have December, and then January would be
so coming up pretty fast.
the legislative session.
So also typically, if they stay on their usual schedule, in November, the Kapuna Caucus will have everybody present at that meeting, different bills that they're supporting. So that's on the same day. So you may hear something, twice, but so of all these things on here that I mentioned, or if you have another idea, which one do you think we should prioritize for November? And out there too, yeah. Cause I'll invite that person. I'll start inviting them now.
Or AARP's ready, might as well start. There.
Okay.
I mean, I checked.
Gary, Barbara, we're thinking maybe AARP in November. What do you think on Friday?
Okay, I'll ask Audrey.
Okay,
Something.
Yeah,
overarching.
and just what bills you guys are actually gonna be looking at, so that's November 7th,
Okay,
Friday, 9:30. Here with Legislative Committee, I guess anybody from PABEA can join us. Okay.
all right, got it.
15-20 minutes,
Okay,
Oh,
okay,
another interesting group, is the Climate Change and Health Working Group,
yeah,
Department of Health.
don't have that here,
So,
Okay.
I mean, just an option,
okay. Okay,
because they are very much focused on mental health.
absolutely.
Yeah.
Okay. Well, should we say for December who we're gonna do too, or should we wait till November? Wait and see what happens? So here's the other piece that Senator Moore Walker referred to. October 1st, we'll know a lot more what's happening. And to that note, just ever so briefly, it's really not gonna spin out until after next year. And then for the next 10 years. And basically, the presentation at Meals on Wheels National Conference is every step of the way it's undoing Obamacare. That's basically how they're reading that. But in the feds can't even tell you because they don't even know what they just passed. And I'm gonna put that on record because that's how it's stated to us. The whole 4 or 5 days that we were at the Meals on Wheels, each of the groups that were presenting from DC were trying to understand. And they basically said of the 1,000 pages, the folks that passed that don't even know. Because now they have to implement it. It's no different than here. We pass bills and then implementing it is a whole nother can of worms. So it's gonna spin for a while. I will say what did happen successfully, and this is to the importance of testimonies, is I sent a letter out to many of us here from Meals on Wheels way back when they were gonna cut Meals on Wheels, and 55,000 people have responded on that day, and they backed off of that. So it's so important to write a good testimony. Okay, so next, we're gonna go into legislative committee bills and topics for assignment. So my hope is that here too, so I mentioned this earlier, each of us takes an area that we want to focus on and follow those bills. There'll be more bills than we can do, so it probably could take more than one. And so we'll need to decide together as legislative, committee, which bills we're going to support, and then we're gonna take that to PABEA, and then we'll vote on, what bills we're actually going to be covering, and then with Christina's help, and with the PAR, understanding how to look at stuff, we'll just, each meeting will walk through that process, okay? So, to that note, and we have till 11, so we have a half hour, okay. I think houseless stuff, Sarah, you wanna take the lead on that, right? So we'll just keep doing that. I think very important to connect with what Senator Moore-Walkie just brought up and building those connections and, so this is Hawaii-wide, that we're looking at for all of that stuff. So it's not just those that are, don't have a house, but those that are at risk as
risk.
well, yeah.
Mhm.
I've been doing a mental health presentation and I've been using, I've reintroduced the Maslow hierarchy. And the first two rungs are, right, food and shelter. And so food and shelter and then safety is next. Those two are what most people are dealing with out there. And I call that clinical case management. That's really what we're focused on there. It is mental health, but it's really the case management.
Basic.
And so the bills that have been introduced, that have passed, what's needed to get them implemented, the bills that are sitting out there that could be introduced, anything new that we could be doing. So Sarah, if you want,
Yeah.
and if you want help with that, yeah.
I'm sorry, I have a question as to how we're trying to figure this out. Like, do we have a list of our special interest areas or whatever? Cause right now there might not, we don't know what bills are out there, right? So
Right.
are we going to prioritize, like our special interest areas that we're gonna target and then divide that up? Or are we going straight to some bill that may or may not be?
Well, what I did for this agenda that we sent out, so that's the whole thing. I have to write the agenda early too, so. We took the bills that we were working on last year and the ones that hadn't passed, and we're looking at whether we're introducing those. And then some other interests that people have, like I threw in human rights and stuff like that in there. So we can add anything we want. Christina's done a great job of breaking down what passed. I think this that Senator Moore-Walkie brought over is pretty helpful too.
Well, yeah,
So there's a,
what kind of gave me the idea, like,
Yeah.
should we decide on like the top 5 categories that we want to
right,
be aware of and work
Mhm.
on? Or are we just gonna go on?
It seems like that'd be very useful
Yeah.
to know the interest areas on a, like more of an umbrella. You're interested in these things, and what are the aspects underneath that
Okay.
that impact
Yeah,
that particular area?
so these bills that I'm running down here right now are the ones that we focused on in the past.
Mhm.
So why don't I get through these just because we only have a half hour. If we want to add something, that's my question. We can certainly do that. So the houseless part is there. So the hearing aid bill, I'll certainly cover that, but I think we're gonna change up this year a little bit. So last year I wanted to introduce, but it didn't get any traction. And given that Tori has it on a little bill that she wrote that actually was heard already, the annual checks is what I would like to push for. So she's actually, Tori, so we can have her come and speak. What she's proposing is a task force. And Senator Moore-Walkie and Rep. Chun asked her to put some funding into that. She has some people that can do data. But the bill we focused on is focusing on the task force, but also to move towards having annual hearing aid checks. Well, it'll probably be every 2 to 3 years. We gotta work on that. With people's physicals that are 55 or older. Part of the issue is people wait 20 years to do something about their hearing because it's so gradual oftentimes, except for her case, that they don't even realize it. By the time they realize it, the damage is done. So if we support that as PABEA, I'll work on the hearing aid piece with her. The human rights resolution, I'm gonna table that for right now, because I need to hear from Senator Rhodes as to what his thoughts are, because I sent an awful lot of information. So I'll check in with him on that. What was the Uniform Care Healthcare Decision Act?
That was a bill that was introduced last year that consolidates puts together all of the healthcare decision acts, including a mental health care decision act. The bill got all the way to conference and was at the very last stage, and it passed through conference, but then got retracted back. Because there was a lot of concern from the healthcare community, from the aging advocates, that when the bill was, there was not a lot of input provided, or basically advocates didn't know about it. And so they wanted time to be able to read the 90-page bill, to be able to provide feedback before it passed. So they just want to work closely with, the folks who've introduced the bill and put it together, so that they have input in how it goes.
Okay. Does someone wanna take the lead on that one?
Marilyn was working on
That's right, I
that,
thought so,
so,
okay,
but maybe check in with her next
Yeah,
time, because
okay.
she's not here,
so
but
maybe
she
Marilyn,
was, she's been part of the advocacy group that's been working on it.
okay.
So can I just clarify? So we're talking about, we're going to be bill focused versus supporting interest area. That's
Sorry,
what this is.
if you wanna, discuss how you're going to, prioritize what bills or priorities you're going to
Mhm.
support, that should be added into the agenda. So we have to have a separate discussion for that, and we can add it for the
Right.
next meeting.
Yeah, I was
So,
just
so backing
to
up to
clarify
procedure,
what you were
procedure,
suggesting.
so backing up to procedure, so I try to write the agenda early enough that I get it out to us. And if you have feedback, you need to do that early, so that, because once this becomes agenda, we can't, and we
Right.
have, and I certainly have been guilty, we veer off of that, and we cannot do that here. So I'm sorry, we're limited to what I actually put on here, and we worked on this before I went to the Meals on Wheels conference, yada, yada, yada. So I'll try to get it out early enough, but
Okay.
So just to maybe intersect your point, Rick, and what I think
Sarah,
Sarah and Shelley are saying is for the next agenda item is to determine a process and methodology to what rises to the top
Yes.
with regard to issue areas, possibly first, and then connecting possible policy strategies behind it.
On the nose.
Yeah.
Yes,
Yeah.
thank you.
okay, so.
Rick, were all these items priorities previously?
Yeah.
Okay, they were all identified. as
Well, not every
priorities.
single one of them, not everyone, some of them.
Uh-huh,
Like I say, the human rights one, that's a separate one.
okay.
That's come in since this new administration.
Mhm.
It wasn't needed anymore.
That Barbara brought something up.
Yeah.
Last year.
Hmm.
Yeah.
Having to do with a condominium. Oh, no, of ombudsman. Care home. Human rights within a care home, so it has been brought up.
Yeah, true. Okay, so Alzheimer's and dementia bills, I'm happy to cover that. I know Kathy and Barbara are both on the team, so we'll pick that one up. If anybody wants to, there's potentially 4 bills that they're going to introduce. So guys, some of this is because there's bills that get introduced every year. And so because it does affect Papuna, it is what we look at. We can always add additional things. So to Derek's point, just get it to me what you want to cover. I'll get it on the agenda so we can actually discuss it going forward if there's something that's missing here, but I'd like to get through the list.
Sorry, and just to add, these are Alzheimer's and dementia bills in general.
Yeah,
That can include Alzheimer's Association bills. But there are other bills that are introduced related to Alzheimer's and
Yeah.
dementia that, Alzheimer's Association isn't necessarily introducing, so it's all bills related to.
right. So I know there's some interest in disaster emergency preparedness, especially for Kapuna. And definitely considering what we just experienced with the potential tsunami. So there's someone that wants to cover that area, so I'll put that out there.
Wasn't there something that was pass this last session about that?
It was, I think, a resolution,
Resolution.
but this is just for this coming session.
Ray has a lot of interest in that, I know, but she's not on this committee, or is she?
No,
No,
he's
because
not.
she's in the other committee, but she definitely does have interest.
Right. And she knows a lot about it too.
Okay. But maybe somebody not in the committee will cover something. Within PABEA,
I don't know if you can do that.
can't do
Rick,
that. Okay.
can I ask, did you mention the certified mail for long-term care insurance?
Nope, I think I have it in here though, today.
Yeah, it's a number, is number 2.
Oh,
Something
there we go.
about Peter
wanna co-
Fitz's bill, letter. Did we get copies of that letter?
Yes, it got sent.
He did send it, yeah,
I
Oh.
emailed to everyone
like 3 weeks
this
ago, yeah.
Monday, yeah, and a couple weeks ago.
Okay,
So there's,
Okay, I would be interested in that.
okay,
okay.
so Barbara for that one. And you want any help with the Alzheimer's one also, or?
Yes, please.
I don't think anybody stretched too far.
Ye-
Okay, well, so we don't have anybody for disaster emergency preparedness, we
I'd
definitely,
be willing to volunteer for that.
you wanna do that? Okay. And then Raylene has a lot of information too, so you might just
Okay.
let her know you're,
Okay.
she'll fill you in. Um. So needs of non-Medicaid senior population.
That was brought up by Marilyn,
Oh, okay.
last year based on a webinar that she saw and, that was kind of updating on the HR1 and then the potential impacts.
Yeah.
That's gonna come up
so-
big time.
So as it plays out probably in the next meeting, I can see it playing out already that the members are gravitating towards community issue areas.
Yeah.
I see that happening
Yeah.
already. So if the committee maps out the issue and what are the larger issue areas and folks are gonna gravitate towards there, then the members can track existing bills, they can help support adopting or implementing new
Yes.
ones, right?
Yeah, yes. Cause the trends are gonna play out, and so there's gonna be bills that haven't been introduced
Yeah,
that we need to focus
Correct.
on.
and I think what's happening now is that different potential or existing policy opportunities are kind of thrown out on the table and then it's, I'll take that, right? It's kind of
Right.
all over the place, right? Yeah, but I think if the group organizes in the next meeting by issue areas, folks like
Let's do that.
Steven, Shelley are gravitating already towards
Yeah.
certain areas.
Okay. All right, so last year the bills that didn't pass, so she's got a little bit of Senator Morawaki on here. So the Kapuna Caucus ones, so Gary's actually covering the caregiver tax credit. Right, Gary?
Right?
I assume ARP will be on board with that again.
Yes,
Medicaid funding appropriates funds to increase funding for Medicaid in-home services. So that's similar to the number 9, huh? Needed
Yeah.
Medicaid seniors, so think about that one. SNAP, so Barbara, Sarah, you also mentioned an interest, so. I think the shift of the age alone, it makes it a huge issue that's coming up soon, so. Barbara, you still okay covering that, the SNAP, along with?
Yes.
And then paid family leave, Kiki caucus package. Gary, you're doing that one also?
yes.
Just to speed this up a little. And then other legislative bills to consider, so I already talked about the hearing aid. One of the ones that Peter Fitch and the Deaf Blind Task Force was working on was the GE tax hearing aid cut. So that bill didn't pass last year, so that'll get reintroduced. I can follow that because it falls right into the hearing aid stuff. And then I just opened it up for other hearing aid, other stuff. So we'll take your input and what Derek is suggesting. We'll put that on the agenda for next time. But those are the ones that I have on here for right now. again, so I put the preamble on here again. I'm sure you're all aware. Go ahead, Shelley.
Before we move on.
Yeah.
I just wanted to, inquire, and maybe this is already in the agenda, I apologize. But I'm interested to hear what EOA's legislative priorities are. And if we should be helping to support that.
Yeah.
Oh,
Yes.
absolutely.
I think, I'm not sure if Caroline's gonna be at the meeting today, but she was going to discuss it. I can say we don't have any big bills. It's the ones it's related to PABEA. And I think we're also kind of in the wait, trying to see what the impacts are with HR1 and how we can support and what that's gonna, what that type of support looks like, either legislatively, programmatically, policy wide, so.
Mhm.
But I had a question about that Medicaid funding.
Yeah.
What was that all about? Refresh my memory. Was that, when it says appropriates funds to increase the funding for Medicaid in-home services, is that? I'm wondering, does that mean increasing the rates of payment that are paid to providers, or what?
No, there was a separate bill for that. There was a bill, and I don't know if that, I don't think that passed, but there was a separate bill that would increase provider rates for in-home services. So that was a separate bill. This bill is just specifically to just increase funding for those who receive, so that more people, it would expand the amount of people who would be able to receive in-home services. So if there's more funding within Medicaid, then they can increase the amount of people who are eligible for it. And then the type of, I guess, services, but I don't know, this is very unlikely that this bill will, and, I'm not an expert, I can't predict the future, but with the HR1, and with the potential, the state, increase to states, responsibility increase in terms of funding Medicaid, that's gonna, I think, kind of be considered for this bill. So yeah, as much as I think this was introduced before HR1, right? Before we knew what all the things were, so.
So all the bills I just covered were last year's bills before HR1. So this year going forward, so a little bit of the ambivalence right now is that we don't really know. It is going to change though. And so I think it's going to be a kind of like a hurry up and wait kind of scenario. So as things kind of play out, it's gonna play out a little bit differently.
Was the bill to increase the Medicaid provider rates, or was it to do a rate study? I can't remember.
There was a separate bill for that, yes, yeah. And I don't remember if that passed or not, but I know, I think, no, there was a bill to increase the rates for the providers, but that didn't pass, so then it got changed to a study, yes.
So Kathy was on a panel and I see she left, but she was working on that one.
And it may
In the
have been
past.
a resolution that it turned into, so, but yes.
Okay. All right, so you made suggestions for agenda for next meeting. We'll take that and we'll spin that into our agenda to go forward. I think, given that'll be in November, hopefully we'll have a lot more information by then. Next, so we don't have a legislative meeting in October, as we mentioned earlier, because we're gonna do the public access room. They're gonna come over here, do a training for all of PABEA. So that'll be October 3rd from 9:30 till 11 in place of this meeting. And then we'll have the regular PABEA meeting. Of course, today at 12, we have the PABEA meeting. And then the next Kapuna caucus is October 3rd at 2 p.m. And again, that's only on Zoom. And then you all are here early on today. We just switched the day because of the HPGS conference Thursday. Friday. Over at Alamoana Hotel. All right, that's what I have for this meeting. So our next meeting is November 7th at 9:30.
And just a quick reminder, if you do have other suggestions for agenda items to add to the agenda items, just email Rick by middle of the month prior to the upcoming meeting. So that way then he can add it to the agenda.
Yeah, and I appreciate the feedback. So the goal here again is that everybody has, you know, the passion to cover an area that they want to cover going through next year. The how-to, we'll fine tune that as we go along. We'll bring in people to help us. I think the importance of doing PAR now is really good.
It's a good idea.
And then if you really want to go meet with somebody over there and you want me to join you or help with that, just let me know. We can do that. They're happy to do it by Zoom also, so you don't have to fly over to do something like that.
I think maybe as it plays out in the next meeting, the group will likely have to discuss what conversations and strategic development happens in this room.
Yeah.
And then how that builds into the general BOP on what levels of discussion and
Yes.
strategy.
Yeah, so
Yes.
the hope here is that you have an area of focus that you really want to do. And you come here to sort and then also to share. Because as we go along, so Christina, having her on board is just remarkable. She'll give us a lot of that update kind of stuff. Oh, the other thing is when we'll do this more, but as you do a testimony, if you're the lead, it's helpful to share it with the group so we can see what you wrote, so we can piggyback on that. And help support, you know, what we've all decided. And we'll certainly talk about it in the minutes also with PABEA. So, I mean, if we're all working together. So as Senator Moriwaki's said in the past, we've done pretty good with getting bills passed. That wasn't always the case. And I think a lot of that is because we're all working together. So appreciating this team.
I think too, you know, being able to have those special interest areas or categories for policy development will help us too, because then you could get speakers
Yep.
for those areas,
Yeah.
right? I mean, whatever we decide.
Yeah.
If we choose 3 or I don't know,
Yeah.
then at least we know what we can focus on.
Right.
Yeah.
I think it's so important to have folks, I mean, coming to talk about their bill and how we can help with that. Not the expectation that so maybe we pick folks that are already bills that we're actually going to support. Yeah, so.
So,
There we go.
Rick, sorry,
Anybody else?
Susie said she had to leave,
Oh.
and she said, let her know what bill she can follow or take the lead on, so.
Okay. All right, so also in the meantime, if you have thoughts, if you heard a bill that you want to support, let me know. We would just put it on there and start with that also. All right, so that's it for,
And then you have to adjourn time.
yeah, all right. I don't look at me. Okay, nothing else for today? All right,
Anybody on Zoom?
anybody on Zoom have anything?
No, thank you.
All right, so meeting adjourned at 10:53.
Thank you.
See you at noon.
Sorry about the crazy intrusion, interruption. So,
Is that the first time that's ever happened?
Here,
yeah,
Uh,
yeah.
I've heard it
So-
a couple of places.
I hope this person
I
doesn't.
heard it, you know.
Oh,
I've
yeah.
heard it
We can
before.
stop it.
I hope we don't.
But now I know where the remove participant button is and,
Uh-huh.
yeah, cause I was looking for it on the participant list.